How's everybody doing? Welcome to the Larry Show. Today I have something a little bit unique, a little bit, not really unique, but it's something that really that happened today and at work. And I don't know if I've mentioned, I work at Walmart. It's unfortunate, but I work at Walmart. I'm pushing my way through college, and I work at Walmart. Well, today was the day we have to enroll in our benefits for 2012. So I go in. We have a meeting to talk about the new stuff, the new provisions, the new whatever you want to call it, rules, the new plans. And I go in. I sit down. We start this meeting, and they begin to tell us this here, and this is what really got me. They tell us this year, new from Walmart, if you smoke cigarettes or you smoke tobacco, you will now be charged double for health insurance. Double. I mean, that's crazy, right? That's crazy. I mean, I've I mean, sorry. I look at that and I say, oh, how dare you? How dare you say that you're going to charge smokers double? I mean, what is this world coming to where they can just reach their hand into your pocket just because you smoke? I mean, you got to think, you pay taxes on the cigarettes that you buy, and then now they're going to charge you a tax on top of the tax. I mean, that's basically what it is you pay the tax on the cigarettes, and then I'm going to be taxed because I smoke. So all in all, I mean, I'm paying basically, $10 a pack of cigarettes now. I mean, if you break it down, I mean, that's crazy. That's absolutely crazy. I mean, isn't the economy bad in America? Isn't the economy bad where, no one can get jobs and this and that and the other, and there's non-existent middle class anymore because it's either poor or rich now because the middle class just can't survive anymore? I mean, shouldn't we be lowering healthcare rates, not raising them? I mean, what the hell is this? What about what about obesity, right? Why are the smokers? That's what I'm wondering. Why are the smokers being attacked? I mean, the smokers. Tobacco's been around forever. Since it was discovered. When tobacco was discovered, natives were smoking it. I mean, it's been around forever. We've always been smoking. This country is built on tobacco. It's built on tobacco. If it weren't for tobacco and the smokers that smoke tobacco, we would have a larger deficit. I mean, the government gets trillions of dollars in fresh revenue from smokers, from tobacco tax. I mean, don't tell me they don't either. I mean, why else are there, large taxes on cigarettes? I mean, they're making money off of this, but then they're going to penalize the smoker. I mean, I don't know. It irritates me. I think it's ridiculous because what's next? Next year it's going to be if you're obese. If you're overweight, you have to pay double on your health insurance. Or what? You go to a movie theater, and if you're a big person, you go to a movie theater, they charge you 2 tickets because you're big, right? I mean, that's what it is. If the government is able to reach their hands into your personal life, because smoking's a life choice. It's a choice. You smoke if you want to smoke because it's not illegal. It's not illegal to smoke. It's legal. It's fully legal to smoke. So if you decide you would like to smoke, you smoke. Yeah, I know it's bad for you. Of course it's bad for you. I mean, but everything's bad for you. Everything in this world is bad for you. It's bad to have too much of this, too much of that, too little of this. Everything's bad for you. So basically what I want you to take away from this and leave comments on is, what do you think about this? Do you agree with it? Do you think that smokers should be charged double because they're a liability? But if you are that guy or that woman that does believe that, I want you to stop just for a minute. Do me a favor. Stop for a minute, and I want you to think for a minute on that subject. What if it was something you did? Something that you do. Pick something. Something you do that they're going to now next year say, you do this, so you're going to pay double. I want you to think about that before you make the decision to say, yeah, I agree with it. If you still agree with it, great. I mean, that's your opinion. But personally me, I'll put it out there. I don't agree with it. I think that's ridiculous to just pinpoint smokers and say you're going to pay double because, that leaves out obesity, that leaves out alcoholics. I mean, they say obesity is an epidemic in this country, right? An epidemic. But they don't care about that right now for health insurance, right? Because obesity doesn't cause any problems with your health. And don't get me wrong, I'm not attacking big people or obese people because I'm overweight. I'm working on it, but I am overweight. So I'm not attacking them, so don't think that. I'm not attacking them. I'd be right in that bracket. Next year, if they're saying they're going to charge for obesity, boom, right there. I'm in that bracket. So, I mean, don't think that, that I'm attacking big people. But I think, personally, because this year, this is the topic, smokers are getting charged double on health insurance if you're a Walmart employee. And I've also found out other companies are starting to do it as well. So I want to hear your thoughts on that. Let me know what you think. Let me know if you agree with it, disagree with it, any comments you have, anything you've been through, anything you want to say. Thank you for listening. This has been The Larry Show. Have a great night, folks.